Thank you for staying with us. We have health this morning, and our guest is Dr. Thompson. He's a consultant orthopedic surgeon with core focus areas in joint replacement and spine surgery. And today he has joined us. Where?
Am I on?
Yeah, it is. And of course, he has joined us to discuss arthritis and the triumph of arthroplasty. It is great to have you. You're welcome.
Thank you so much.
Okay, so let's explain the terms we're working with today. Arthritis, arthroplasty. Let's explain terms so that people can understand before we get straight into the discussion.
Yes, thank you very much. Arthritis simply means a painful joint.
A painful joint.
A painful joint.
Oh,
Simple
I like
as
that.
that.
I like that. Simple answer. So to a layman, what is arthroplasty?
Arthroplasty is a surgical procedure done to replace the articular surfaces of joints that are affected by arthritis. Particularly severe arthritis.
Now, you spoke about severe arthritis. Let's talk about the rate. What's the percentage of infection when it comes to arthritis? Because I know quite a number of people. It's something that is quite common. Do you have any figure or something as to how many, what's the percentage of people, maybe adults or something, that are infected with arthritis?
Well, I wouldn't use the word infected.
Okay.
I'll use afflicted.
Afflicted, all right.
Yes. Although infection can be a cause of arthritis, which we call septic arthritis, tuberculous arthritis. Such disease can cause arthritis in the long run. But those afflicted by arthritis, majority of them, due to senility, longevity of age, wear and tear, those who have had injuries in their joints in the past, elderly individuals, those who have problems with probably crystallization in their joints, causing inflammation of those joints. Yes, they have arthritis. And it's quite common, actually. I'm sure in almost every household in Nigeria, a family member, loved one, has arthritis. Yes.
Is it something that can be prevented?
It can't really be prevented because by nature, the cartilage, which is the plastic covering on over the ends of the bones forming the joints, actually, we humans can't rejuvenate the cartilage. So they kind of wear off.
They wear off with time, yeah.
So as long as we live long enough on this world, we'll definitely have arthritis one way or the other.
Now,
one or two people may be free of it. I won't say it's an absolute, but yeah, most of us definitely.
What part can exercising play in all of this? Can it delay it, or maybe
It's both ways.
Okay.
Regular guided exercises can actually prevent onset of arthritis.
Okay.
Because motion of the joints actually nourishes these joints and makes them healthy.
Okay.
However, excess exercises, excess sports can also lead to increased wear of those joints.
Of those joints, exactly.
That's why you see sportsmen are heavily paid.
Yeah, they are. Exactly. In fact, there's this, the Nigerian Sadi Kumar who just tore his ACL, and that's like 6 to 9 months and all of that.
Yeah.
Now we talk about where does arthroplasty and all of that. How does it work when it comes to helping people with arthritis?
Well, arthroplasty. Why I feel arthroplasty is a triumph in the face of arthritis is the fact that just over 100 years ago and all the way back to time immemorial, mankind had been afflicted by arthritis.
Okay.
And many of them live out the rest of their lives with this kind of condition, miserable, with pain, incapacitated, deformities, dependency on others. So you can name it. It's quite a challenging disease, particularly if one is suffering it or you are taking care of someone who's suffering it. That's the only time you tend to appreciate the impact this has on
the human life,
on humankind. Arthroplasty, over less than 100 years back, has kind of been perfected in such a way that those with severe disease can have surgeries and have their life back again. And they can go back to walking, independent walking, back to their lifestyles, whatever it is they were doing. Sometimes even going back to sports.
So you mentioned something that those joints were of, those arthroplasty, is it like it gives you Does it put new material there?
Yeah. We're going to put synthetic materials there.
Oh, okay.
But they are like inert materials that can stay long in the body without causing any form of reaction.
That would mean that
decades.
That would mean that such a procedure would be expensive. It wouldn't be very easily accessible.
Unfortunately, yes, it's expensive. Anywhere in the world you go to. Arthroplasty is a very expensive procedure. Let alone in Nigeria, where we depend on bringing these implants in.
Okay.
And on Forex and all of stuff.
And all of that, exactly. Wow. So, if untreated, what are the worst things that could happen in the body? When
untreated, arthritis, well, as I said earlier, pain. Every day you want to get out of the bed, you're in pain. You want to put on your shoes, you're in pain. You're thinking of how to make your steps every day of your life. So it can really be a big toll. Arthroplasty it's a surgery that is done in a safe manner. Patients are actually checked properly to be sure that they are actually suitable for such procedures. And once done, usually by the next day, they start to walk again.
For people who can't afford it, is there any way to manage the pain?
Yeah, arthroplasty is actually meant for severe diseases.
Okay, for severe.
It's never a first stop treatment. No, never.
Oh, okay.
We start with medications, physiotherapy. We can give injections into the joints. Some have used acupuncture. Okay. And all of that. So, yes, to try and help alleviate the pain. Lifestyle modification is also very important. Okay. Someone with a knee arthritis living on maybe a 3-story
third floor, exactly. You have to come down and over. Worst case scenario, what will happen? Would the joint be unusable entirely? Would mobility be?
Arthritis can be quite bad. Patients can be severely incapacitated. In fact, I remember a patient of mine who I treated a while back, some years back. She had a complex knee replacement on the left side, in which the joints were just wobbling around.
Wow.
So there was no ligamental structures to actually
support that joint. Even just saying it now, I'm trying to picture what you're saying.
Yeah, so we had to do a replacement for her, which was a complex type of replacement. And then the right was also very bad. And she had, a year after, a replacement on the right side.
Wow.
And I made her to walk after about 6 weeks from the whole procedure and everything.
From the whole procedure and everything.
And when I asked her, when last she walked, she said 11 years.
Ago. Wow. So let's give some hope, because this is quite a bit, but like you said, it can be, because with age and all of that, there are things that also affect and will come on. Best case scenario, how best can one take care of himself or herself in such a way that maybe you can delay it for as long as possible? Yes,
very beautiful question. First thing first is to maintain a healthy lifestyle.
Okay.
Maintain a healthy weight. Because the more
weight on the joints
you have, the more weight on the joints. Also to avoid sports that may predispose you to having such arthritis coming in early. High-impact sports. Now, I'm not advocating we shouldn't have sports. But
I understand you, yes. High-impact sports.
High-impact
sports. They do have their own.
Yeah, those who have bad knees already kind of like step down on running, jogging. I saw
someone doing pole vault on sand.
Pole vault on sand.
Yeah, and he just stick the pole and then jump, and then there was no foam, to cushion the fall, and then landed on his legs.
Nigeria?
I'm telling you. I saw a video, it was like 2 days back.
That's crazy.
And you know the impact that will have when you land on the joint, and that's what you mean. All right, thank you very much, Doctor. This was quite an educative session, and I hope people out there were able to pick up something and, give themselves the best chance against arthritis.
Of course.
All right, thank you so much.
Thank you so much.
All right.